Rheumatology at HSS is a very full partner with orthopedics, whether we're identifying the proper point in time in a patient's course to go to surgery, preparing patients for surgery, providing medical care post-op. But the rheumatologists also see patients with musculoskeletal and chronic inflammatory disease over the whole course of their illness.
And I'll motivate the discussion by presenting a case of a 55-year-old who's had long-standing mild osteoarthritis, but now has persistent pain over the last 3 months, worse with some mechanical maneuvers such as pivoting. The patient undergoes an MRI, which shows a meniscal tear and also some cartilage defects. And the question is raised by the patient's clinicians and by the patient to think about with his family whether to proceed with arthroscopic partial meniscectomy or with non-operative therapy. This is a surgery that's done in patients just like this, people with concomitant osteoarthritis, about 400,000 times per year in the United States.
Lupus is a multi-center autoimmune disease, and it really can affect most organs in the body. But because it's a disease of women and generally presents during what we call reproductive years, pregnancy is a major problem that the patients face. When you give the diagnosis of lupus to a young woman, the first thing she asks is, can I get pregnant and will it affect my children and what will my pregnancy be like? Well, we have some ideas of what the pregnancies can be like in patients with lupus.
What I want to do is give you an overview of how we might ultimately get to a point where people can prevent and even cure, i.e. drug-free remission, our patients at risk or with new onset RA. And so we need to consider where the window of opportunity for study and treatment is, how RA actually develops, what studies are being done to try and prevent it now, and looking at who will predict severe disease or RA itself.
What are your thoughts, all of you, about how we can feasibly collect the important clinical data that will allow us to prevent disease, given the financial constraints and just logistic constraints that we are faced with?
We've been collecting clinical data on lupus patients for 20 years. I mean, Dr. Christian remembers when we set up the first lupus registry. And I think over time we've gotten more and more sophisticated in terms of the number of data points we collect, but it's done with a coordinator and manually. And I think the key will be with an electronic medical record that feeds into a database. Most of the things we're interested in are collected by good clinicians. They just have to be retrieved and organized.